It's a division of Nebraska Dolph Ichterts. I can't even barely say his name. Folial. Forgial. I don't know. So, I'm actually going to watch my surgery and describe it in the most technical of terms. And you can see what I am describing. Here we go. Dolph Ichtert was my doctor. He is a endoscopic carpal and cubital tunnel release dude. So he's a board certified orthopedics and hand surgery surgeon. And he was kind enough to give me this video. So I need y'all to know I have suffered from carpal tunnel, since I got pregnant. And Dr. Ichterts told me, that is a hard name to say. He's like, most people think that it's work related or whatever. But here's the thing. It's actually an inherited condition. And as our bones grow, they get tighter. So most people don't really have problems till they're like 45 or something. Mine set in when I was in my early 30s. So I had this one sliced open. And what he does is a scope surgery. So they go through the wrist and they come out in the palm. And I'm going to describe what you're about to see. So, Dr. Ichterts, thank you so much for this. Here we go. See how this tube is in my wrist? This wrist right here. This was less than 2 weeks ago. So see how there's a slit at the top of the tube? What that tube does is protect everything that's in the wrist so he doesn't cut anything else, except he's gonna release this transverse ligament so that the nerve, the carpal tunnel, the median nerve, so the median nerve has more room. So, but there he goes. We're gonna slice it. Now, on this arm, about 15 years ago, or this wrist, I had a different procedure done. Do you see how it's just slicing with that little tool? Slice. And what this surgery allows you to do is not have to cut through the layer of skin and muscle that covers it, which happened here. And it took me a lot longer to recover from this surgery. A week ago, I was scooping poo, but already, I've healed up really well. It hasn't even been 2 weeks. He's gonna go back in there with this little tool, this slicey tool. Slice. This is one of the coolest things I've ever seen in my life. Slicing. I'm sure this is so not how he would have me describe it, but that's what I'm doing. But this is endoscopic, so you just go in there with tools so you can get to things without slicing through a whole bunch of layers like happened on this side. And again, my recovery on this side was really quick and good. Dolph Ichterts, you are awesome. He's at the Nebraska Hand and Shoulder Institute. You guys, he is amazing. Now I'm going to describe the next video, which is just as cool. Are you ready for this? Oh, this is the best part. Woohoo! This is you're going to be like, what? Now watch this. This is the cool. See that thing in my arm? See that, or my wrist? See that long tube? He's gonna screw this tool in there. This is carpentry on a whole different level. Okay, see, he's gonna screw this little tool in there, and Dr. Ichterts is gonna just like, whoop, pull that baby out. Oh, that looks painful. Good thing I was out. Oh, see, he's getting that little tool out of there. Boom, and we are done with the surgery. That is amazing. And I'm no longer numb. I'm no longer numb. I was numb for a very long time. These 3 fingers go numb, and these two fingers go numb from the ulnar nerve. Now I also have ulnar nerve problems. I actually had an ulnar nerve transfer on this elbow and a carpal tunnel release here, 14 years ago. And this side we're trying to avoid this one. I've got this brace thingy that he has me wear. At night, it's not easy to sleep with, but we're trying to avoid the ulnar nerve transfer. But I have a recurrence on this side, so guess what's gonna happen? I'm gonna actually have the right side done again as well. And this is different surgery. We're not even going to talk about that one. But he did both of these at the same time. But that's the carpal tunnel release. Now, what I want you guys to know is you don't have to be afraid of that. The thing about surgery is it gets the pain taken care of, and it gets you back to work or back to normal activity, quickly. And that's the point of doing this kind of surgery. And Dr. Ichterts, I mean, I love you. Thank you. This was quick and fast. I had to get back to work easily. I just huge shout out to Dr. Ichterts. I mean, come on. For the video, for educational purposes, this is so cool. I gotta watch this one more time. I gotta watch this thing be pulled out of my wrist. So he's gonna screw this little corkscrew thingy in. Oh, look at that wrist. Oh, go Dr. Ichterts. How many thousands of times have you done that? Oop, pull it, rip, Oh, it's a good thing I'm out. Oh, come on. Whew. All done. Less than 2 weeks, people. Less than 2 weeks. That's what this one was splayed open. Had to go through a layer of skin and a layer of muscle to get to that tendon that needs to be released so that the nerve has more room in there. Because as you grow, your bones get bigger. It makes that whole thing tighter, or makes the pathways tighter. A lot of people think that it's work related. It's not. It's an inherited situation. Totally inherited situation. And when I went in to see him, he was like, one of your parents had to have had it. I'm like, absolutely my dad had it, because he was constantly having me rub his hands. His hands had to have been numb all the time. But my dad was the kind of dude who he didn't even get Novocaine when he went to the dentist. He'd be like, nope, I just do it. So that's me describing the surgery that you are seeing. Hope that was a cute little side note for you. Don't forget to subscribe, hit the bell, turn on your notifications. Bye, y'all. I don't know, release tendon, separated edge of release, formal fascia, impinging on radial nerve, folial, pharyngeal, I don't know,